Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today we're here with Dr. Majid Fotuhi. Thank you for being with us here today, Dr. Fotuhi.
Thank you.
Dr. Fotuhi is a Harvard and Johns Hopkins trained neurologist and neuroscientist. Dr. Fotuhi is widely regarded in the field of memory, aging, and increasing brain vitality in late life. He has numerous publications with 25 years of teaching experience, clinical work, and neuroscience research. He is currently the medical director of NeuroGrow Brain Fitness Center, the chief medical officer at NeuroCore Brain Performance Center, and affiliate staff at Johns Hopkins. Today we will be discussing stress and the brain. Thank you again, Dr. Fotuhi, for being here.
It's my pleasure to be here with you. Thank you.
So today we're going to be discussing stress on the brain. So Dr. Fotuhi, tell us, how big of a role does stress make on our brains?
Stress is really bad for every organ in your body. Stress is, for example, bad for your skin. The more stress you have, the more your skin wrinkles. Right. Stress also is bad for your heart. The more stressed you are, the more likely it is that you will have a heart attack. But stress is particularly bad for your brain. It increases the risk of stroke, but it also contributes to the shrinkage in the brain. Let me give you a tour of the brain.
Sure.
So this is a model of the brain, and this outer layer of the brain is called cortex.
Okay.
This is where the higher cognitive functions reside. The front of the brain is for decision making, the sides of the brain is for listening and hearing. There are parts of the brain deep inside, it's called hippocampus, that's important for memory. There's also parts of the brain inside and also around the midline that are important for your emotions and how you feel.
Okay.
These parts of the brain can shrink if you're stressed out too much. In fact, there's a relationship between the degree of stress and the duration of stress and how much your hippocampus shrinks. So people who are stressed all the time, they're actually contributing to the shrinkage in the brain that eventually can lead to the Alzheimer's disease.
So is this something that can be measured? Obviously the stress level and what that does in relation to your brain, to the hippocampus?
Yes, that's an excellent question. The more stressed you are, the more there will be levels of a hormone in your blood called cortisol. And the high levels of cortisol can actually affect the skin, the heart, and the brain. Okay. And so we can measure how stressed you are by measuring the cortisol levels in your body, in your blood.
Okay, great. So that's definitely something that we could, if you feel that way, you could find your doctor and get that checked out if you needed to. But of course, that's affecting the brain, the hippocampus as well.
Yes, and recently there's another way of looking at the brain and to find out if somebody's stressed or not. Because sometimes as a neurologist, I see a patient who smiles and seems all happy on the outside, but in the inside, in their brain, there's a lot of stress. Their brain is overly active, and there are lots of connections. There's a chaos in the brain, but on the outside, they look like they're calm. And this is called quantitative EEG or brain mapping. This is one more way we can look at someone and decide whether or not they're experiencing high levels of stress and anxiety.
Okay, so brain mapping, is that something that is done there you can do in your office, or a test that is done at a radiology center?
Yeah, brain mapping is not routinely available at radiology centers. We do have it at my brain center, and a few other places in the area also offer quantitative EEG, also known as brain mapping.
Okay, so really it's these expectations that we have for something that the outcome is causing the stress because we're expecting that it's going to be a certain way when really we should just think either there will be traffic or I will have to wash the dishes myself.
No, so with the ABC model, with the spouse, the action happens and the B says, my husband never works in the house, and then if he ever does the dishes once, you're happy. Right. Or you give him a reward that will make him want to do the dishes, and then the consequence will be different. So the stress is self-induced. We're stressed because we make ourselves stress. Now, sometimes there's a fire in a fire or a flood, and those things are natural things that induce the stress. So the most important thing to do to be less stressed is to be mindful of your belief system and realize that it's you who's causing the stress on yourself, and that's bad for your heart, for your skin, and your brain.
Okay.
The second thing is good for reducing stress level is to make sure you have had a good night's sleep. When you don't sleep enough, the cortisol levels in your body are high when you wake up in the morning.
So that's the stress level increasing.
So your body is already stressed. And because you have not enough sleep, you cannot make good decisions. So you get into arguments, you do not get your job done well, and bad things happen to you.
Okay.
So you really need to make sure that you get your 8 hours of sleep, and you should make that a priority. So if you have to check Facebook or go to sleep, just go to sleep.
Right, yeah, and with social media, I know that's probably one of the hardest things where people have to cut off, leave their phones out of the room, and make sure that it's something that the 8 hours are the most important part then.
That's right.
Okay.
A lot of people say, well, everybody has sleep problems, so I have sleep problems too. That's not a good argument, because other people may be smoking, other people have bad habits. Just because other people have it, it doesn't mean you should be doing it.
Right.
So with the sleep, you have to make sure your room is quiet, the room is dark. You have to make sure that sleeping is the only thing you do in your bedroom, no exercise machine, no TV, no eating, and those sort of things. So then the third thing on the list is to meditate.
Okay.
When you meditate, you reduce the cortisol levels in your body. Also, meditation increases blood flow to the brain. So when you meditate, you not only calm your brain, reduce the levels of cortisol, you also increase blood flow to your brain, so your brain becomes younger. You rejuvenate your brain when you meditate.
So what would you say in detail for someone who doesn't meditate or doesn't even know, okay, what do I have to do to meditate?
So a simple way to start meditation is to sit down in a quiet room, take your shoes off, put your feet on the floor, and put your hand on your belly, and then take a slow, deep breath. So like that. And you can count to the count of 7 to take a deep breath, then hold it for a count of 7 and breathe out for a count of 7.
Okay, I'm trying it now as you're saying it, okay.
You'll be amazed how quickly you feel calm when you do the breathing exercises. You could do this when you're driving, for example, or if you're just sitting waiting for things. So those slow breathing is a good way to start. Another thing you can do is that when you're sitting and breathing, you think of a mantra, a peace or beauty or ocean, and then you keep repeating that, and every time your new thoughts come to your mind, you try to just push it aside and think about that. So
Okay.
to clear your mind.
Concentrate on that one mantra. And how often should this be done? Every day?
I usually recommend 10 minutes, maybe 4 days a week.
Okay.
More importantly, you have to have the ABC model in your mind. So when you get upset, ask yourself, what caused me to be upset, and how can I change my view so I will not have this experience again?
Okay, great. So we have the ABC model, making sure that we're getting enough sleep, and the meditation.
The fourth thing on the list is something called neurofeedback. Neurofeedback is an EEG biofeedback treatment that's available in some centers in this area. We also offer it in my brain center. With neurofeedback, we show a person their brain activity.
Okay.
And every time their brain activity moves toward normal, they get a reward. The reward could be a sound, something that happens on the screen, or a game that they move forward to. And neurofeedback has been shown to reduce stress and anxiety by 80 or 90%.
Okay, so it's a reward system for your brain.
Yes, it's based
Okay.
on operant conditioning that helps you change your brain chemistry and your brain structure. See, meditation is one way to do it because you try to calm your brain. But with neurofeedback, which is the EEG biofeedback mechanism, we take control of your brainwave activity, and then we reward you every time it becomes normal. So your brain should be here, and it's here. We set a reward if you come from here to here, and so your brain calms down a little bit. And the reward, again, this could be something happens on the screen. A ball
you
goes
see.
up, a balloon moves, a butterfly comes to you, and the more it comes to you, it means that your brain is calming down.
Okay.
And it usually takes 24 sessions because it's not just medication. The other thing I recommend is for people to stay away from medications. Unless you have bad anxiety, depression, natural interventions are best for managing stress and anxiety. It's best not to get stressed in the first place,
Right.
rather than have medications to reduce and calm your brain.
Okay, so not having medications for the stress is what you mean. Okay, great. So thank you so much. That's wonderful. The neurofeedback is really interesting, and maybe we can go into that a little bit further at another time. But we'll definitely keep in mind that ABC mantra of making sure that we're the ones in control of the stress, the sleep, and the meditation time. And of course, we'll discuss a little bit more about the neurofeedback. So thank you, Dr. Fotuhi. It was a pleasure to have you here with us today. Thank you for joining us. My name is Alejandra Gonsalves, and this is Virginia Medical Updates.